So right now he is basically in what we call status epilepticus.
Yeah.
He is in a constant seizure. We cannot get him out of it. I've basically anesthetized him at this point. Every time the anesthesia even slightly wears off, he goes right back into a grand mal seizure. He's having facial seizures pretty much constantly, which tells me that that means he's still having seizures. He's still seizure activity going on in his brain. The fact that he's been in status for, from what we know, maybe 24 hours, is a very bad sign. The elevated body temperature can be a number of things. One is it could be because he's having seizures for this long and they didn't do anything about it. It could be because he could have inflammatory disease in his brain, like meningitis. We don't know at this point. What I do know is that he is very malnourished. His body condition is poor. He is dehydrated. I'm sure he's not drank anything in at least 24 hours if he's been having seizures that long. The thing that we don't know is, A, what's causing all of this, and there's several things that I am thinking could be causing this. And we also don't know what kind of damage has been done to the brain after seizing for that long. Things that I'm worried about with him are, first, and kind of the thing that's most likely is congenital disease in the brain. If he's been having this since 2 to 3 months,
we figured that.
And Chihuahuas are very predisposed to hydrocephalus.
Yes.
So it's very likely that that's the cause. Other things would be like
eye bulging. Is that hydrocephalus? Like you can sort of see it if the eyes are bulgy, especially in a breed that's not supposed to have bulging eyes, where they're
right.
Because I did see pictures of him where he was normal. His eyes were bulged and they were
pointing out,
and that's I kind of thought
like
fluid in the brain.
Normal.
Yeah,
it's possible. I mean, it's all connected, and if he has that much pressure in his brain,
and then if like this eye thing happened and he did have this fluid on the brain, that would just exacerbate everything, right?
Yeah,
I thought.
Or pain.
Right.
I mean, it's
anything
excruciatingly painful. Yeah.
Well, and he was screaming in the videos. I've never seen a seizure with somebody screaming or an animal screaming.
It was bad.
It was.
And who knows how? My guess, and I guess we'll never know, is that eye injury was probably during a seizure. He was probably seizing and slapped his head and his eye on something, traumatized it. Now he has this very severe ulcer on that eye, to the point where I'm worried that it's actually ruptured or about to rupture, which obviously is another problem. Do they think he's been blind since 2 months old? Like he's never been visual?
Well, we just have what the vet says in February at 4 months that he was blind.
Right. Okay. So he's probably been blind this whole time.
We thought he actually kind of...
I thought he looked at me, but at the same time, if he was having facial seizures, maybe that's what I saw with the eye.
Yeah.
And I'm used to blind dogs having that haze look over.
Not always. Yeah, if he's centrally blind, meaning like if it's due to not like his eyes not functioning, but the nerve function, the eyes can look completely normal, but they can still be blind. If the blindness is due to something within the eye, yes, a lot of time they look cloudy. They can look a whole lot of different ways.
Right.
But my suspicion is that up until now, whatever happened with his eye. Because the other eye looks fine, It's just, I can't tell if it's visual at this point because he's in a seizure and basically anesthetized right now. But I'm guessing he's probably been centrally blind, like because of nerve issue. The last thing that I would, or I guess the second thing could be a meningitis. So they can get meningitis and encephalitis, which is inflammation in the brain. That's possible, although that would be pretty rare to have a meningitis that young, like have it start that young, like at 2 months.
Could it last this long too? I mean, wouldn't he be dead by now?
Probably, yeah. I mean, if it's been this long.
Not to the vet, not antibiotics, nothing.
I can't imagine if he's not been treated for meningitis and it's been going on that long, probably would be dead by now. The last thing that I'm that is possible, and I think it's much less likely based on the blood work, is something like a shunt in his liver, which can.
He did do like the backwards walking and stuff, and I even thought about that subluxation. I mean, it could be so many things.
What about? Did you say autoimmune yet?
Well, meningitis is usually autoimmune.
Right.
Yeah. It's usually not infectious. It's usually immune disease. There's not a whole lot of other immune diseases that would cause this in a dog. But I truthfully think we're very likely to be dealing with a severe congenital disease. I mean, the history fits, and those diseases get worse over time. And so the fact that maybe he hasn't been having these as severe seizures for his whole life, but now clearly they're getting worse to the point where I'm not sure if the owner like surrendered him.
Yes.
Yes.
Okay.
It's the only way we're taking him.
Yeah. So they surrendered him, and probably because the seizures were getting so severe and they just didn't want to deal with it anymore. So it's unfortunately, I do think that his prognosis is not good. I mean, regardless of what's causing this, it's gone on for so long and it's so severe that it's truly causing him severe neurologic issues. The fact that he's been having seizures that long is also really bad. I mean, even if we were just dealing with that, a seizure for 24 hours can cause significant brain damage. I mean, and who knows how high his body temperature got during that time. And you hate to think of it. So I think at this point we have a number of options. One is if we wanted to confirm what's going on in the brain, we would have to image his brain, something like an MRI or a CAT scan, to see what's going on in there. It's really the only way to know what's going on in there. The second option is we treat him with everything we've got. I mean, we can give him medications to help decrease swelling in the brain. I would keep him on steroids. They've already started that, which is good. And I would just literally give him as many anti-seizure medications as I can to try to get things under control and see if we can. We may not be able to, but we would just kind of treat him as aggressively as possible. The last option is to put him to sleep, and it's obviously not what anyone wants to do, but I am worried about him, and the poor thing has been suffering. I mean, it's just awful. And of course now, and the eye issue is like a whole other thing that we would have to deal with too. Certainly less pressing, and if he's been blind this whole time, because the worst case scenario with a melting ulcer like this is they lose the eye, and if he's been blind anyway, it wouldn't affect his quality of life. He's I know I'm sorry, this is really difficult.
He's not even my dog.
I know. I mean, it's just awful to think what he's been through for the two years of his life.
I mean, I don't think that we really care what's going on in the brain, do we? I mean, we want to stop the seizures, right?
Yeah.
And I don't know if that's possible.
Right.
When do you give up? When do you say enough?
Can you bring him out? Do you always bring them out of a seizure? Do they go into a seizure that you can't bring them out of?
Yes.
It happens with people.
Yes, and that is my worry with him, especially when they are in a seizure this long. Cluster seizures, which are when they have frequent seizures, but they come out of it in between. That's when
his, even like what I called it cluster seizures, but whenever he came out, he didn't come out. Yeah. It was nothing, and he just went right back into one.
And that is like the definition of status epilepticus, which literally means one continuous prolonged seizure, where he's literally not even coming out of it before he goes into the next one. Right. Clusters are dangerous, but they actually come out in between, and whether that's a minute or whether that's hours later. When we have dogs that, we have a lot of seizure dogs that we treat here, and they call in, they say, my dog's had 2 to 3 seizures in a 24-hour period. We're like, get here so we can stop that cluster before we get into this
Right,
situation,
right.
because when they do get into this status period, it can be really difficult to get them out of it. Even if he didn't have severe disease in his brain, which clearly he does, it's just a matter of what kind of disease. You know, even if he were just purely epileptic, where they just get seizures for no reason,
Right.
when they get into this kind of cycle, even those dogs are really tough to get out of a seizure. And with him, we've given him Valium, we've given him propofol, we've given him midazolam, and he's still in it. I mean, and the second he even remotely kind of wakes up, he's right back in it again. So unfortunately, it's definitely a case where we may not, no matter what we do, may not be able to get him out of it. I would say, when do we, like, if we give it a shot and try to get him out of it, I would probably say, you know, because I would give him several things, and if we can't get him out of it after giving all those drugs, and we give him, like, you know, several hours, then I'm really worried that it's not gonna work.
I mean, I don't think that we should spend the money on an MRI and CT scan if we
Not
can't
at
come out
this
of
point,
seizure.
yeah.
No.
He's literally not even stable for that at this point
Okay,
anyway, because
okay.
I wouldn't be able to do it right now regardless.
How bad do you think the brain damage would be if he comes out? I mean,
How much pain is he in now, or can you control that?
He is, well, his eye is certainly painful. The seizures themselves are not necessarily painful, but they're very, you know, very disorienting. I mean, it's like,
When she was picking him up out of the crate to bring him in here, he was screaming as if he was in pain.
and that can be part of the seizure. So
Okay.
I'm guessing that was likely due to the seizure activity, because some of them can vocalize and scream during a seizure.
okay,
You
that's
know.
interesting. I never heard
Yeah,
that.
or is he screaming because his eye hurts? That's possible too. Or is he screaming? Meningitis, if this is meningitis or encephalitis, that is painful.
Okay.
The congenital diseases, it's hard to know if it's painful. I mean, those basically cause so much pressure in the brain that they have seizures, and that's basically what hydrocephalus is. I would imagine that's gotta be painful. It's gotta
Yeah,
like,
I feel like a splitting headache.
yeah, I'm guessing that's what it feels like, and you know, they obviously can't tell us, but
What would you do? That's the question.
that's a tough question. It really is.
Is there any way to approach it practically
Mm-hmm.
that would, within a couple hours, or so, would give you
Yeah.
hope
Mhm. Yeah.
to know that,
Do we think it's gonna work or not?
even on the flip side, further thinking of how much brain damage has been done?
That part we won't know. Or if we're able to get him out of the seizure, it only time would tell us that. 'Cause
And
right
we're talking what? Walking, urinating, defecating, the whole 9 yards.
Urinating and defecating.
Walking.
But the
Right.
walking, yeah. I mean, if he literally just lays there and can't
Right.
move, obviously.
And
we're
at
not
this
gonna allow
age, I
that.
mean, he's only a year old.
Yeah, and I guess the other thing we need to think about is what his quality of life will be long term regardless. You know, like if we're able to, I guess hypothetically, if we're able to get him out of this and get him somewhat stable, he will deal with this forever. I mean, it's
Right.
the way his brain was formed, most likely, and
Or not formed.
or not formed, yeah, or not formed or malformed, and so he will suffer from seizures. I mean, forever. It's just a matter of controlling them as much as we can, so this doesn't happen.
Right. Do you think there's at all a chance there that he could have a quality life?
I think there is a chance, yes. What I don't know is how high of a chance that is. I do think, unfortunately, I think the chances are lower than we'd want, and this is just literally guess, probably 20 to 30% chance. I don't even think I would give him a 50-50 at this point, just with everything that's gone on and his history, or at least what we know of his history. It makes me really worried that he's been suffering from very severe seizures for this whole time.
Right.
And now all of a sudden they're just literally getting so bad that the owner was like, I don't want this anymore.
No, she actually did not want to surrender him.
Yeah.
She showed up on her doorstep this morning, found her address, showed up on her doorstep and said, he is going to die. He is going to die.
Yes.
And if I would have known it was that bad last night, I would have left work and went and got him. Like, I didn't know.
No.
I thought it was an eye issue.
Yeah, how would you know? There's no way you could have known that.
You're just sitting there holding him thinking it's okay. Now I'm pissed. Just letting it out.
Yeah.
Now I'm pissed.
Malnourished, do you get that part?
I'm pissed.
She's telling me to be nice to the owner because
Because I didn't know yet.
Yeah.
I just didn't know, but I'm pissed now.
malnourished as in,
His body condition is poor.
but it could be autoimmune too.
Meningitis shouldn't necessarily cause that. It wouldn't cause, autoimmune disease wouldn't cause him to become emaciated. If he's been so...
But if it's like rheumatoid arthritis or...
It's not. So it's not anything like that.
Get the bear out of the
Okay, it's okay.
It's he wasn't eating. He was sick, not feeling well, either having constant seizures, and he wasn't eating. Just like he wasn't drinking. They couldn't even find a vein today whenever I took him to the vet.
Yeah, we had a lot of trouble. My nurses are very skilled.
Oh, I know. I knew you would.
And
You can even see his veins.